Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Natural Family Planning. Introduction. Natural family planning is a form of birth control that determines when a woman is most fertile each month. On the days when a woman is most likely to get pregnant, sex is avoided. A variety of methods are used in natural family planning. They are most effective when used together. It is important to remember that each form of birth control has its advantages and disadvantages. While natural family planning can be effective in preventing pregnancy, it does not protect against sexually transmitted diseases or STDs. This program focuses on natural family planning. It explains the different methods of natural family planning and how you can use these methods to avoid pregnancy. Pregnancy. In order to understand natural family planning as a form of birth control, it is important to understand how natural pregnancy happens. This section reviews reproduction. The female reproductive organs are located in the pelvis between the urinary bladder and the rectum. They include the ovaries, the fallopian tubes, the uterus, the cervix, the vagina. The ovaries are two small glands with two main functions. 1. The production of specialized hormones such as estrogen and progesterone. 2. Ovulation, which is the release of eggs needed for reproduction. Ovulation is controlled by many hormones. About once a month, an egg matures in a fluid-filled ovarian cyst called the follicle. The egg is released by one of the ovaries into the fallopian tube. If the sperm ejaculated in the vagina are healthy, they travel up the female reproductive tract to the fallopian tube and fertilize the egg. The fertilized egg then divides and becomes an embryo. The embryo travels down the fallopian tube into the uterus where it implants in the uterine lining. The uterine lining is called the endometrium. If the egg is not fertilized, the endometrial lining that develops in preparation for pregnancy sheds. This is known as menstrual flow or period. All of the following must happen in order for a female to become pregnant. 1. The ovary must release or ovulate an egg. 2. The egg must be captured by the fallopian tube. 3. Sperm must travel through the vagina, into the uterus, and up into the fallopian tube. 4. Sperm has to fertilize the egg. 5. The fertilized egg or embryo must travel down to the uterus. 6. The embryo must implant in the uterine lining and begin to develop. Natural family planning. Natural family planning is a form of birth control that uses a variety of methods to determine when a woman is most fertile each month. On the days when a woman is most likely to get pregnant, sex is avoided. Natural family planning is not as reliable as other methods of birth control. The failure rate of natural family planning is 25%. To understand natural family planning, you must first understand the menstrual cycle. During the menstrual cycle, glands in a woman's body provide important body chemicals, called hormones, to keep the body healthy. The levels of these hormones rise and fall during each month and control the menstrual cycle. The menstrual cycle also prepares a woman's body for pregnancy each month. A regular menstrual cycle is 28 days. The cycle is counted from the first day of one period up to and including the day before the next period begins. Ovulation usually happens on day 14 of the regular cycle. A fertile woman is most likely to become pregnant in the 48 hours after she ovulates. Sperm can live up to 5 days in the female reproductive system. This means that a woman who has a regular menstrual cycle has 9 days or more each month when she can get pregnant. These fertile days are about 5 days before and 3 days after ovulation, as well as the day of ovulation. A problem with natural family planning is that not every woman has a regular menstrual cycle. Menstrual cycles can range anywhere from 21 to 35 days in adults and from 21 to 45 days in young teens. Changes in the menstrual cycle make it difficult to predict when ovulation will happen. Ovulation can happen earlier or later in women with an irregular menstrual cycle. From time to time, even women with a regular menstrual cycle may have an irregular one due to sickness or stress. There are 5 natural family planning methods: basal body temperature method, cervical mucus method, symptothermal method, calendar method, lactational amenorrhea. The following sections will discuss each of these methods in more detail.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Basal body temperature method. In short, the basal body temperature method works by using daily measurements of a woman's body temperature. Body temperature increases slightly when ovulation takes place. If the woman knows when ovulation takes place, she and her partner can plan when not to have sex to avoid pregnancy. Pregnancy is less likely from 3 days after the temperature increases until the end of your menstrual cycle. The basal body temperature is your body's temperature when you are relaxed and rested. Your basal temperature is usually between 96 and 98 degrees. Normally, ovulation causes a rise of 0.5 to 1 degrees in a woman's body temperature. However, some women ovulate and do not experience a rise in temperature. You can predict the days you ovulate by checking and recording your basal body temperature each day for a few months. To use the basal body temperature method, you must take your temperature orally the moment you wake up each morning. Record the temperature under the appropriate date on a chart. Women are most likely to get pregnant 2 to 3 days before ovulation, which is before their basal body temperature rises, as well as 2 days after that. This is why it is important to keep track using a chart so you can predict when your temperature will increase. The chances of pregnancy are significantly reduced 3 days after the temperature increases. The chances become near zero towards the end of the menstrual cycle. This is when couples using the basal body temperature method can have sex. Couples using the basal body temperature method avoid sex from the end of each menstrual period until 3 days after the temperature increases because ovulation may come early, particularly if the menstrual cycle is irregular. Sperm can live up to 5 days in the female body. Using the basal body temperature method alone may not prevent pregnancy. The method can be unreliable. Other factors may cause a rise in basal body temperature. Basal body temperature may also rise due to fever, poor sleep, or changing schedules. The couple may think it is safe to have sex 3 days after a temperature increase, but the temperature increase may have been caused by something other than ovulation. The method may work for women who 1. Insist on a natural method of birth control. 2. Have regular periods. 3. Show an increase in temperature when they ovulate. 4. Have the discipline to measure their basal body temperature daily. 5. Agree with their partner to avoid sex for the first half of the menstrual cycle plus 3 days, a period of about 17 days. Cervical mucus method. Couples can also use the cervical mucus method to plan when not to have sex to avoid pregnancy. The cervical mucus method requires a woman to pay attention to the changes in her cervical mucus. Changes in the color and thickness of the cervical mucus can help predict fertile days. Check your cervical mucus at the opening of the vagina several times a day using a tissue or your fingers. Remember to wash your hands and fingers with a disinfectant before doing this. Record the changes in your cervical mucus on a calendar. This will help you track the days when it is safe to have sex to avoid pregnancy. At the beginning of the menstrual cycle, there are usually a few days without mucus. These are known as dry days. When the egg is getting ready to be released, more mucus is produced. The mucus is often white or yellow. It also feels sticky. Just before and during ovulation, the most mucus is produced. This mucus is clear and slippery, like raw egg whites. After about 3 or 4 days of clear, slippery mucus, less mucus is produced. This mucus is sticky and a darker, cloudy color. A few dry days follow the darker, cloudy mucus before another period begins. Sex should be avoided when the cervical mucus is clear and slippery. This is when a woman is most fertile. Sex should also be avoided when the mucus is white or yellow with a sticky feel right before ovulation. This is because sperm can live in the female body up to 5 days. Using the cervical mucus method, a couple may have sex after the clear, slippery mucus ends and until another period starts. Couples using this method may also have sex during the few dry days after a period ends. Symptothermal method. The symptothermal method combines the basal body temperature and cervical mucus methods. It also includes looking for other signs of ovulation. A woman using the symptothermal method records her body temperature and cervical mucus changes every day. A woman using this method also checks for other signs of ovulation. These signs may include abdominal cramps or pain, changes in the firmness of the cervix, changes in the position of the cervix, spotting. However, some women do not notice any clear signs of ovulation. Couples who use the symptothermal method avoid sex at the first signs of fertility, such as clear and slippery cervical mucus or abdominal cramps. Sex is avoided until 3 days after a woman's body temperature increases or once the mucus is no longer clear and slippery. It is then relatively safe to have sex until the end of the menstrual cycle. Calendar method. The calendar method is also known as the rhythm method. This method requires a woman to record her menstrual cycle for at least 6 months. A woman can use the calendar to predict when she is most fertile and avoid sex on those days. To find her fertile phase, a woman should count how many days each of her menstrual cycles lasted each month for at least 6 months. Remember, a cycle is counted from the first day of one period up to and including the day before the next period begins. To find out the first day of the fertile phase, take the length of the shortest cycle and subtract 18. For example, say your shortest cycle was 26 days. 26 minus 18 equals 8 days. To find the last day of the fertile phase, take the length of the longest cycle and subtract 11. For example, say your longest cycle was 30 days. 30 minus 11 equals 19 days. To use the calendar method, take a calendar and circle the day your next period will start. Beginning with that day, count ahead 8 days to get the first day of your fertile phase. Mark the day with an X. Count again from the day your next period will start. This time count ahead 19 days and mark the day with an X. This is the last day of your fertile phase. If you don't want to get pregnant, avoid sex during your fertile phase. These are days between the 2 X days on the calendar. The 2 X days are also a part of the fertile phase. You are most likely to get pregnant if you have sex on these days. Keep in mind that since menstrual cycles can change, this method is not always accurate. It is better to use this method in combination with other natural family planning methods. Lactational amenorrhea. Lactational amenorrhea is only a method of birth control for women who have already had a baby. Lactational amenorrhea means that while a mother is breastfeeding, her periods will not return. During pregnancy, the breasts change, allowing them to produce milk. Breastfeeding causes a change in the hormones that prevents ovulation. If a woman does not ovulate, she cannot get pregnant. After a woman has her baby and stops breastfeeding, the breasts change again and breastfeeding is no longer possible. This allows a woman's period to return and ovulation to happen. Breastfeeding can cause a woman's period to stop until the baby has switched to bottle feeding. Pregnancy can be prevented if the mother breastfeeds every few hours. The rate of failure of this method is less than 1% if the mother breastfeeds regularly. For lactational amenorrhea to be most effective, the time between feedings should be no longer than 4 hours during the day and 6 hours during the night. Always breastfeed your baby when he or she is hungry. Occasionally, using formula is fine, but ovulation may be more likely to return. Lactational amenorrhea is most effective in the first 6 months after birth. However, this is only true if the mother continues breastfeeding regularly. Lactational amenorrhea is not reliable for every woman. Some women can still become pregnant while breastfeeding even if their period has not returned.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Natural family planning is a form of birth control that determines when a woman is most fertile each month. On the days when a woman is most likely to get pregnant, sex is avoided. There are 5 natural family planning methods: basal body temperature method, cervical mucus method, symptothermal method, calendar method, lactational amenorrhea. These methods are most effective when used together. Even when done correctly, natural family planning is not as reliable as other methods of birth control. The failure rate of natural family planning is 25%. This means that 25 out of 100 sexually active women who only use this method of birth control get pregnant within 1 year. Your chances of getting pregnant are lowest if you have a regular menstrual cycle and the method you choose is always used correctly. It also helps if you can notice clear body signs that ovulation is about to happen. Be sure you know the right way to use these methods. Your healthcare provider can help.
Thank you for using Explain.